Canadian military personnel are being deployed to Quebec to support the province's vaccination campaign. Quebec is desperate to speed up its booster program as it faces record-breaking case counts and rising hospitalizations. Bill Blair is Minister of Emergency Preparedness, and he's in Toronto. Hello, Minister. Thanks for joining us today.
Good evening, Paul, and thank you very much for having me on.
So what is the number? I think it's close to 200 Canadian Armed Forces personnel are being deployed to Quebec. What are they going to be doing there?
Well, it's up to 300, and what has begun is that the Canadian Armed Forces are already in Quebec. They're engaging in reconnaissance and analysis on where to best deploy their officers. The number that Quebec has asked for and that the Canadian Armed Forces have approved is approximately 300 people who will be trained and then eventually deployed. These are primarily general duty military personnel who will be deployed to assist in Quebec's vaccination efforts. And there's a number of very important things they can do in order to help facilitate those things, and we're working very closely with the province of Quebec to do that. Additionally, we have a strong relationship and arrangements with the Canadian Red Cross, but Quebec has also engaged with the Canadian Red Cross bilaterally, and will be deploying up to 300 of their personnel in the coming weeks and months as well.
Spread it throughout the province evenly, or are you targeting a specific area of Quebec?
Well, again, we're very much guided by the requests of the Quebec health officials. Primarily, the initial deployments will be in the Montreal area, but they're also looking at moving into other regions of Quebec as required. We're very much in consultation with Quebec health officials and with their government. They've asked for our help, and we're there trying to help in every way we can. And they place a great deal of emphasis on accelerating their vaccination and booster program in Quebec, and they've asked for some help. And that's what the Canadian Armed Forces and the Canadian Red Cross will be doing over the next several weeks.
And I take it they're not actually putting needles in arms, but they're helping out sort of, I don't know what the term, like on an infrastructure basis or an organizational basis. What exactly would they be doing?
Yeah, the Canadian military actually brings a great deal of expertise in logistics and organization. They will be able to help establish and set up those vaccination clinics to organize people, to gather information, to make sure that the process is efficient and orderly, well run, and then there will actually be Quebec Health Human Resources will be responsible for deploying those vaccines. I understand some of the Canadian Red Cross personnel may be able to help as well, but if you've been to some of these vaccination clinics, Paul, I think most of us have seen that, there are people there helping to organize, how people line up and make sure their information is collected and correct. That they're, after the vaccine is administered, people have to be, taken, observed and taken care of for a short period of time. All of that work will be assisted now by the Canadian Armed Forces in Quebec with the deployment of those people. We're going to be training them over the next 24 to 48 hours, and then they'll be available for deployment as early as Thursday.
Now, the request came on the 21st of December. It's only 10, 11 days ago. It doesn't sound like a long time, but Omicron is spreading quickly. It's one of the few things we know about it. Why the delay? What took even that amount of time?
Yeah, well, Paul, there wasn't delay. We went to work right away with the Quebec officials. We have been engaging with them. They knew that they were going to need help, and they gave us a heads up that they were going to require assistance. We went through. Our officials worked really closely with theirs in determining exactly what those needs are, and with limited federal resources that we can bring to bear on their situation. There have been discussions and work ongoing. It has now been determined what they need resources for and how they intend to use them, and that approval was given at the first opportunity, and that deployment is now rolling out. And Quebec has been working hard to get ready to accelerate that vaccination program. They've asked for assistance, and we're able to provide that assistance, and they'll be available this week to provide it.
As I recollect, they were looking for 500, and I misspoke saying near 200. You're saying 300, but that's still not the 500 Quebec was looking for. Is this enough, you think, to make a difference?
Well, I will tell you that the Canadian Armed Forces in every deployment, over 150 times we've responded to the provinces and territories' requests for assistance since this pandemic broke out. And one of our most valuable responses has been provided by the Canadian Armed Forces in long-term care facilities in response to a number of critical incidents that have taken place and crises across the country. These are the resources that are available. They're the resources that we are able to deploy to assist Quebec. my understanding is the Quebec officials are satisfied with the support that's being provided, and we'll continue to ramp up that support in order to provide whatever assistance we are able. And I want to be very clear to the people of Quebec. We and the government of Quebec, the federal government and the government of Quebec have been working very, very closely together in response to this since the outset of the pandemic. And you may recall the deployment of Canadian Armed Forces in long-term care facilities in Quebec, which was then subsequently replaced with personnel from the Canadian Red Cross. We'll continue to work with our provincial and territorial partners when they ask. There is obviously discussion on how we can best help and with what resources are available, and we work through that together.
How else can you help? What have you got in your back pocket if Quebec says this is getting bigger than we expected? What can you do?
One of the things we are hearing from provinces and territories right across the country is that they're all concerned, first of all, with the case counts that are taking place in the hospitals and the need for human health resources right across the country. And there is a critical shortage being experienced. And as many of the people who currently provide those health services, nurses and doctors and respiratory specialists, et cetera, when they become infected with COVID, then there is going to be a significant impact on human health resources right across the country. That's why everybody's working so hard in the vaccination efforts and in the restrictions that you're hearing being placed across the country to do everything we can to slow the spread of Omicron down, to help our health professionals, manage a very critical situation as this particular variant spreads. And that's why, we're doing everything we can to support each other throughout this. I will tell you that there are discussions also underway with, for example, in Nova Scotia to use the Canadian Red Cross there under a contract that the federal government has with them to set up an additional vaccination clinic to vaccinate as many as 1,000 people a day over the next several weeks. And we're working also with Nunavut, with the Northwest Territories, with Manitoba, and with many others. And those discussions are ongoing. Today, of course, we announced and are deploying personnel into Quebec in response to what they asked our help for.
Sure, but to be clear, you say the Red Cross, but are other provinces already, or are you anticipating them asking for the Canadian military to help on this?
Well, when they ask for help, they generally don't ask for specific types of resources. They ask for help. They outline what their concerns are, and then we meet with them and discuss what resources we can bring to bear. In some circumstances, those have been financial resources. And for example, we've seen in Northern Ontario, a number of First Nations were really in a very difficult and dangerous situation as a result of the spread of COVID in their communities. And the Indigenous Services Canada has gone into those communities and provided financial and other supports. We've also deployed rangers, military personnel, public health agency of Canada personnel into those areas as well. We'll continue to bring whatever resources we have available in order to support the provinces and territories. But there are obviously limits, and so we have to prioritize in those deployments to the most vulnerable communities and to areas of our country and regions that have the greatest need. And so we'll continue to do that work in collaboration with our provincial and territorial partners.
All right, and indeed, your work is cut out for you right now. Bill Blair, thank you so much.
Thanks very much, Paul.
Bill Blair is the Minister of Emergency Preparedness.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.